Understanding panic and anxiety disorders, symptoms, causes, and effective treatments. Panic and anxiety disorders are common mental health conditions affecting millions of people. Do you feel overwhelmed by fear and dread without any apparent reason? You may be suffering from panic disorder. Imagine feeling trapped in a cycle of worry, fear, and panic. This is the reality for those living with anxiety and panic disorders. Panic disorder is characterized by sudden and intense episodes of fear, while anxiety disorder involves persistent worry and fear. These conditions can cause physical and emotional symptoms that can severely impact daily life. Effective treatment options, including therapy and medication, are available for those suffering from panic and anxiety disorders. And before we start, smash that subscribe button for more videos like this in the future. 1. The difference between panic disorder and anxiety disorder. Anxiety disorder and panic disorder are two separate conditions, although they can share some symptoms. The main difference between the two is the nature of the fear and anxiety they cause. 1. Anxiety disorder. Anxiety disorder is a general term that refers to a group of conditions characterized by persistent, excessive, and irrational fear or worry. The fear or worry can be related to a specific object or situation, such as social situations, social anxiety disorder, or it can be more general and not related to a specific object or situation, generalized anxiety disorder. 2. Panic disorder. Panic disorder is a type of anxiety disorder characterized by sudden and repeated episodes of intense fear that can last for several minutes. During a panic attack, a person may experience symptoms such as a rapid heartbeat, sweating, shaking, and a sense of impending doom. The fear caused by panic attacks is typically related to a specific object or situation, such as being in an elevator or being in a crowded public place. In general, anxiety disorder is characterized by persistent fear or worry, while panic disorder is characterized by sudden, intense episodes of fear. Both conditions can be treated with therapy and medication, and the treatment approach will depend on the specific symptoms and needs of each person. 2. Panic disorder symptoms. Panic disorder symptoms typically include 1. Sudden and intense fear. People with panic disorder experience sudden and intense episodes of fear that can last for several minutes. 2. Physical symptoms. During a panic attack, a person may experience physical symptoms such as a rapid heartbeat, sweating, shaking, and a sense of impending doom. 3. Avoidance. People with panic disorder may avoid certain situations or environments that they associate with their panic attacks, which can impact their daily life and functioning. 4. Fear of future panic attacks. People with panic disorder may worry about having another panic attack, which can increase their anxiety and cause them to avoid situations or environments that they associate with their panic attacks. 5. Anticipatory anxiety. People with panic disorder may experience anxiety and fear in the period leading up to a situation or event that they associate with their panic attacks. It's important to seek help from a mental health professional if you experience symptoms of panic disorder. A mental health professional can help diagnose the condition and develop a treatment plan that is right for you. Treatment may include therapy, medication, or a combination of both. 3. Anxiety disorder symptoms. Anxiety disorder symptoms can vary depending on the type of anxiety disorder, but some common symptoms include 1. Excessive worry. People with anxiety disorders may experience persistent and excessive worry or fear about a range of events or activities, even when there is little or no cause for concern. 2. Physical symptoms. Physical symptoms of anxiety can include a rapid heartbeat, sweating, shaking, dizziness, and difficulty breathing. 3. Avoidance. People with anxiety disorders may avoid certain objects or situations that trigger their anxiety, which can impact their daily life and functioning. 4. Sleep problems. Anxiety disorders can interfere with a person's ability to fall asleep or stay asleep, which can exacerbate their anxiety symptoms and make them feel more fatigued during the day. 5. Restlessness. People with anxiety disorders may feel restless and unable to sit still or be calm. 6. Irritability. Anxiety can cause irritability, which can make it difficult for people to relax and enjoy life. 7. Concentration problems. People with anxiety disorders may have difficulty concentrating, which can impact their work or school performance. It's important to note that everyone experiences anxiety and fear at times, but anxiety disorders are different in that the fear or worry is excessive, persistent, and interferes with daily life and functioning. If you think you might have an anxiety disorder, it's important to talk to a mental health professional for a proper evaluation and treatment. 4. Causes of panic disorder. Panic disorder can develop at any age, but it typically starts in young adulthood. There are several factors that can contribute to the development of panic disorder, including 1. Genetics. A family history of anxiety disorders, depression, or other mental health conditions can increase the risk of developing panic disorder. 2. Trauma. Exposure to traumatic events, such as physical or sexual abuse, can increase the risk of developing panic disorder. 3. Life stressors. Major life stressors, such as the death of a loved one, a divorce, or financial difficulties, can increase the risk of developing panic disorder. 4. Substance abuse. Substance abuse, especially heavy alcohol or drug use, can increase the risk of developing panic disorder. 5. Chronic illness. Chronic medical conditions, such as heart disease or diabetes, can increase the risk of developing panic disorder. It's important to note that having risk factors does not mean that a person will definitely develop panic disorder. Many people with risk factors never experience panic disorder, while others may develop the condition without any obvious risk factors. The exact cause of panic disorder is not known, but it is believed to be a combination of biological, genetic, and environmental factors. 5. The dangers of leaving anxiety disorders unattended. If anxiety disorders are left untreated or become severe, they can lead to several potential risks and complications, including 1. Physical health problems. Chronic anxiety can take a toll on the body, leading to physical health problems such as headaches, muscle tension, digestive issues, and heart problems. 2. Substance abuse. Some people may turn to drugs or alcohol as a means of self-medicating, which can lead to substance abuse and addiction. 3. Social isolation. Severe anxiety can make it difficult for a person to participate in social activities, leading to feelings of isolation and loneliness. 4. Poor academic or work performance. Anxiety can make it difficult for a person to concentrate or perform tasks, leading to problems at work or school. 5. Depression. Chronic anxiety can lead to depression or worsen symptoms of depression if it is already present. 6. Suicidal thoughts. In severe cases, anxiety can lead to thoughts of suicide or self-harm. It's important to seek help if you're experiencing symptoms of an anxiety disorder. With proper treatment, it's possible to manage and reduce symptoms, and prevent these potential risks and complications. 6. Panic disorder treatments. There are several effective treatments for panic disorder, including 1. Psychotherapy. Cognitive behavioral therapy, CBT, is the most widely used form of psychotherapy for panic disorder. CBT helps individuals identify and change thought patterns and behaviors that contribute to their panic attacks. 2. Medication. Antidepressant medications, such as selective serotonin reuptake inhibitors, SSRIs and benzodiazepines, can help reduce the frequency and intensity of panic attacks. 3. Combination therapy. Some individuals may benefit from a combination of medication and psychotherapy. 4. Self-help techniques. Deep breathing exercises, progressive muscle relaxation, and mindfulness meditation can help individuals manage panic symptoms and reduce the frequency of panic attacks. It's important to work with a mental health professional to determine the best treatment plan for your individual needs. The treatment plan may need to be adjusted over time based on your response to treatment and the presence of any side effects. With proper treatment, many individuals with panic disorder are able to manage their symptoms and lead fulfilling lives. 7. How to deal with people suffering from anxiety disorders. There are several things that can be helpful for people who are struggling with anxiety disorders. 1. Reassurance. Letting someone know that they're not alone and that their feelings are valid can be a huge source of comfort and support. 2. Encouragement to seek professional help. Encouraging someone to seek help from a mental health professional can be one of the most important things you can do for them. 3. Mindfulness and relaxation techniques. Practicing mindfulness and relaxation techniques, such as deep breathing, meditation, and yoga, can help to reduce symptoms of anxiety. 4. Exercise. Regular physical activity has been shown to reduce symptoms of anxiety and improve overall mental health. 5. Supportive relationships. Having supportive friends, family members, or a partner can be incredibly helpful for people with anxiety disorders. 6. Education. Learning more about anxiety disorders, including the causes, symptoms, and treatment options, can help to reduce the stigma associated with mental illness and empower someone to take control of their mental health. Remember that everyone's experience with anxiety is unique, and what works for one person may not work for another. The most important thing is to be there for the person and support them in finding the resources and treatment that work best for them. Before concluding, if you like this video, don't forget hit that like button, and subscribe to this channel for more videos like this in the future. Also, be sure to turn on the bell notification so you never miss any of our videos. In conclusion, panic and anxiety disorders are prevalent mental health conditions that can significantly impact daily life. It's important to understand the symptoms and causes of these conditions to improve awareness and reduce stigma. With the right support and treatment, including therapy and medication, recovery is possible. Self-care techniques, such as exercise, relaxation, and mindfulness, can also help manage symptoms and promote overall well-being. It's essential to seek help and support if you or someone you know is struggling with panic and anxiety disorders, as effective treatment can lead to significant improvement in quality of life. So, what do you think about this topic? Let us know what you think in the comments section.